Hello, 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 and welcome everyone. My name is Zami Tinashe Hemingway, and I am the Capacity Building Assistance CBA Gender Affirming Project Manager with Denver Prevention Training Center. If everyone could please change your name to the first and last name that you registered under so that we can take attendance, that would be wonderful. If you can also include your pronouns so that everyone is honored, that would also be appreciated. Thank you again for coming out to today's COP. I want to briefly share more information for folks who may be joining us for the first time. As part of Denver PTC CBA funding, we are providing technical assistance in the West region to CDC directly funded community based organizations and their clinical partners to address social determinants of health, gender affirming and integrative services, and delivery of status neutral services for transgender and gender expansive people. We work closely with 15 jurisdictions in the West to collaboratively provide services for transgender people in alignment with the Ending the HIV Epidemic initiative. If you are not a directly funded organization, we can and will be happy to provide TA support to you as well. Email me at zami.hemingway@dhha.org for additional information. Thank you again for being here today. I want to turn it over to Callan and Jordan to continue our conversation on legal transitioning and access to care.
Thank you so much, Zami. Um, let's see. Okay, so we're gonna get the PowerPoint pulled up here. So thank you so much, everyone, and welcome. I really appreciate you taking the time this afternoon to join us for the second part of this two-part series where we're discussing legal transition and its intersection with HIV prevention and care. Uh, there's going to be a range of fluency on the subject. Some of you, this may be entirely new, and others, it's probably something that you have too much familiarity with. But I'm excited that you're all here wherever you're at on that scale, and I'm hopeful that you'll participate in today's discussion to whatever degree you feel comfortable. We're going to have a lot of opportunities for you to participate. We're going to be covering a lot of ground between last session and this one as well again today. And I'm going to save some time at the end to specifically go over questions, anything that you want to ask. But I also want you to feel free to jump in at any time in the chat, or if you prefer to come off of mute and ask your question live as they come up, I welcome that as well. So my name is Jordan Blisk. My pronouns are he and him. I'm going to be the primary facilitator of today's COP. I'm a lawyer by trade, and beyond my own personal experiences with legal transition, I've worked to help transgender and non-binary individuals through their legal transitions since 2016. I was the first out trans student to graduate from the University of Colorado Law School. And in addition to my role here as an identity consultant, I'm also the current executive director for the Colorado Name Change Project, as well as the president of the Colorado LGBT Bar Association. Also with us today is Callan Smith, a fellow identity consultant. And Callan, I'll turn things over to you to introduce yourself.
Hello all, I'm Callan Smith. My pronouns are he, him, his. I am the Digital Communications Manager for Aurora Mental Health Center. As a transgender man, what drives my work here is the desire to educate and help improve outreach to transgender and non-binary people.
Thank you, Colin. Before we get underway with today's session, because I am a licensed attorney, but only here in the state of Colorado, I'm going to be, sorry, thank you, Zami, I appreciate my fault. I forgot to give you a cue there. I'm going to give a quick disclaimer about the presentation just to make sure we're all on the same page with regards to the context of the information that we're going to be discussing. So this presentation and its information is intended for educational purposes only and should not be constructed as legal advice for any particular situation. No attorney-client relationship is formed between the attendees and the presenter of this publication simply by attending this program or by referencing its materials. Next slide, please. And Callan, do you want to go over the objectives for today's session?
Sure. All right. Today, we're going to be covering the basic process by which transgender and non-binary people change their legal names and gender markers on state and federal identity documents. along with the obstacles preventing many from accessing legal transition and the benefits it provides. Then we'll turn specifically to your role, to the role your organizations and staff may play in this process, and discuss strategies for providing supportive, gender-affirming care to patients who are legally transitioning. By the end of the two community of practice sessions, the prior one and this one, we'll be conducting, you'll be able to define the legal transition process, describe how legal transition intersects with accessing HIV prevention and care services, describe how legal transition intersects with medical transitions, describe the barriers preventing individuals from obtaining identity congruent legal identification, and provide CBOs with action steps to improve their ability to offer status neutral, gender affirming HIV prevention and care. You will also be provided action steps to improve your ability to offer status neutral, gender affirming HIV prevention and care services. Jordan, I'll pass it back to you.
Thank you, Callan. So for those of you that were able to join us last month for the first part of this COP, I'd love to start by just opening up the chat and seeing what y'all took away from that, what stuck with you about session one. So if you could, if you attended session one, let us know, what do you remember? What were your takeaways?
And feel free to put your comments in the chat box or unmute and talk to us. Come on, what do you remember from this brilliant session one? Talk to us, colleagues.
I'm just going to unmute because I really appreciated session one. I actually messaged a couple folks afterwards and was like, this was a really phenomenal COP. So I've been really looking forward to today's. But one of the big things I took away was just the cost of legal name change and the cost of getting documentation set up. And then it spurred me looking into other organizations that help to cover those costs for folks and what might potentially be available in terms of like micro grants. So yeah, that's the piece that's really has stuck with me since our last one.
Well, thank you. I appreciate that. And yeah, you're so right. That was a huge part of what we talked about in session one. For those of you that weren't able to join us, were some of the access barriers that trans folks face in obtaining their legal name changes and gender marker updates. And the process really ranges quite a bit. But you know, on the low end, you're looking at several $100s. And you know, we know the trans community is one that is particularly economically marginalized. You know, the communities of color are also economically disenfranchised, and so there's no surprise that those tend to result in trans folks of color specifically having really disproportionate access to legal transition. Yeah, absolutely. Anyone else? Any other takeaways from session one? Oh, well, we'll go ahead and go over a little bit of a recap then, since I imagine some of y'all are just joining us here for the first time today. So in review, here's some common language, starting with what legal transition means. So this is when we say legal transition, we're describing a process by which transgender and non-binary people change their legal names and/or gender markers to better align with and represent their gender identity. Broadly speaking, there are three sort of buckets that actions which transgender people take to transition fall into: social, medical, and legal. Social transition often involves things like coming out as transgender, changing aspects of one's appearance, dress, and/or behavior, as well as sometimes the name or pronouns that they go by in kind of interpersonal interactions. I know y'all are familiar with the idea of medical transition, which typically includes things like hormone therapy and a variety of gender conforming surgeries and treatments. Ultimately, legal transition is just one more way that transgender people can authentically express our identities and have them recognized by society. And so just like medical transition, not everyone legally transitions, and there's not a one size fits all answer to how to be transgender. But many non-binary and transgender people do choose to update, or I'm sorry, change their names and update gender markers as a necessary part of their gender transition. Next slide here, please, Zoe. So we're going to talk a little bit more today. We talked in session one about kind of what is this need and why can't folks, update these items. And today we're going to be talking more about the nitty gritty details of the records and where y'all come in. But before we do that, can y'all tell me in the chat or come off mute some types of IDs or records that you can think of off the top of your head that have your legal name? Where are places that hold your legal name in some sort of record? And court documents, social security card, passports, lab orders, medical records, driver's license. Yep. Bank. Yep. Y'all are on it. Health and education records. Absolutely. Yeah. These are the big things, right? These are the things that control our lives. Financial documents, mortgage. Yep. Absolutely. Benefits. Yeah. Passports, ability to travel freely. Absolutely. Birth certificates. Yeah, definitely. If you can continue on the PowerPoint here. So y'all did a great job though. In coming up with the big ones, right? We're talking about social security, passports, immigration records, VA documents, military documents. Those tend to be kind of the really big high level things. When that we keep in a safety deposit box, we keep in a special folder, we keep those documents somewhere safe, because ultimately that's how we prove who we are in society, and those things act as gatekeeping mechanisms between us and so many elements of society. And so my goal here today isn't to turn you into legal experts. We're just going to be doing a super quick and high level overview, but I do want you to have a general understanding of what this process involves in a logistical sense, so that you can better understand where you might be asked to play a part. So let's start by going over the three broad categories of IDs that transgender people might need to change. So in bucket one, you've got federal documents, and that's passport, VA, immigration records, state IDs, and that's things like birth certificates, driver's license, or state identification cards. And then pretty much in the third bucket is everything else. And that bucket is the biggest by far, and that's private records. And that encompasses things like y'all mentioned, such as medical records, financial documents and accounts, things like diplomas, certifications, all the way down to email addresses, social media, etc. All of these things cumulatively make up our life, but there's no central database where you can just change one thing and fix your name and gender marker across all of the places where that data is held. Rather, you have to make these changes directly through each and every organization that holds that data. Next slide, please. So it's best to think of names and gender marker changes as pretty separate processes, even though they're often completed as a concurrent process. Authority to change legal names is controlled by your state of residence, not by the federal government, which means that every single state in the United States has kind of its own process. 49 states, every state but Hawaii, uses a court process to change one's legal name. Hawaii uses an administrative process. But even though 49 states use court processes, each state sets their own court process. So it's really 50 separate processes to change one's legal name in this state, and it's dependent on where you're living at the time you want to change your name. I'm also going to note here that the specific steps and what this process can look like varies wildly, even within individual states, especially if cases involve potentially minors or someone with a felony conviction. Those are two things that often add some additional layers of challenge to the process. It doesn't have to, but it can, depending on how your state processes things. Broadly speaking, though, for the court process, what that looks like to get a name change order is to file your name change request by completing a potentially completing a fingerprint-based I'm sorry, this is so many words. Fingerprint-based criminal background check. Such a mouthful every time. Not all states require those. Some of them do. Colorado is one of them. After you complete those background checks, most people will start this process by filing a petition with the appropriate court, paying whatever the fees are that accompany that petition, potentially publicizing your proposed name change in a local newspaper. That is something that not all states require. I think around half do and half don't. There are various ways to request exemption for that, potentially depending on your state. But again, there's no one size fits all answer here. But that is an area of activism that trans folks are working on right now, because it does pose such a serious privacy concern. After the potential publication in a local newspaper, you have a court hearing. And once that's finished, you'll receive your legal order for change of name that's signed by a judge or magistrate. And that really acts as your golden ticket. A certified copy of that order is what you're going to need to change your legal name on any ID, whether it was issued by the federal government, the state government, or a private entity, like Denver Health. On the flip side, there's generally no singular authority to change your gender marker. Rather, changing the gender marker on your IDs and records is a set of administrative processes that are controlled by the organization that issued your ID or record, and falls along a spectrum of how difficult they are to complete. You have to comply with the various rules that each agency or organization, each record holder puts forth, even if they aren't consistent with one another. On one end, when we're thinking about gender markers, in the spectrum of how much it imposes on trans folks, on one end you have an update via self-attestation forms, which allow transgender people to simply sign a form that says, for example, "Dear State of Colorado, I want the gender marker on my birth certificate to be X now, thank you." And they send it back, and you now have a birth certificate that says your legal sex is X. And there's no court process, there's no doctor signing off, it's just you saying, "This is who I am," and it's recognized. On the other end of the spectrum are policies like, unfortunately, the Tennessee Department of Vital Records has, which flatly refuses to allow any gender marker updates on Tennessee birth certificates, period. There's no way that you can overcome that currently to get a gender marker change if you were born in the state of Tennessee. And in between those two kind of extreme ends are states that force transgender people to provide some sort of proof, go through some sort of hoop to get their gender marker updated. And this includes things like providing forms with written permission from their healthcare providers, or potentially even proof of surgery. I will note here that some state courts do issue what are called change of sex orders that transgender people can use as proof to change their gender markers. So instead of having a name change order and then following 50 billion processes, you have 2 orders, and in theory, it streamlines certain processes. However, while that may sound like a bad thing that some courts don't issue change of sex orders to streamline that process, being an administrative process, if it's used correctly, actually allows trans people to avoid unnecessary gatekeeping, because it gives them the power to declare their gender without requiring them to seek and obtain any further approval from a medical provider or a court. And so even though in some ways it makes the process a bit more clear on the update end, it ultimately imposes a lot more gatekeeping on a transgender identity. Next slide, please. Let's see, I've got a question. I've got a question here that asks, does it not go to people first language? For example, trans people versus people who are trans. I personally use them kind of interchangeably. I think I tend to use trans people more, but yeah, I think you can kind of say, you know, folks of trans experience, there are different ways to phrase transgender identity. So we're going to talk here now about ExGender markers. And before we do that, I've got another chat question that I would love to get y'all to jump in on. The gender binary as a construct, it doesn't apply to every person, leading to the adaptation of ExGender markers. Some of you may have heard of that, some of you maybe not. What are your thoughts on an X and gender markers in general? Do you think we need gender markers?
Feel free to unmute or type your response into the chat. While we're waiting, Jordan, give us the case, the use case for gender markers.
I'm sorry, the what?
Give us the use case. Why should we use them?
I don't think I have a great one. I'm going to be honest. I think you know, the most common things that folks tend to point to are collecting for demographic data. You know, and I think that there's value to doing that. But in terms of having gender markers on printed ID cards, you know, I don't think that there's a great argument. But yeah, maybe that's showing my hand a little bit here on what we're going to cover.
Well, I will read the chat. I'll read the chat for you. I got it.
Thank you.
So some people said they're not sure. Another respondent said, I think X-gender markers should be normalized, considering that we are coming to a collective realization that gender non-binary individuals are real and have real experiences in this world. Another respondent said, I think gender markers are excessive on a lot of forms of ID. My driver's license has a picture of me. Why does it also need to have FMX? Another respondent says, it seems the very least for statistical purposes. So I think a lot of people agree with you, Jordan, that there may not be a use case for it.
Yeah, and that segues perfectly in here. Thank you, Zami. I appreciate you advancing there. So what I want to cover here in this slide is you know, obviously for many people, selecting M or F as a gender marker option, it's simply just not accurate. It's not who they are. And over the course of the last few years, states around the country and countries around the world have begun to recognize the vast spectrum of gender diversity that exists in humans by offering, you know, what's been offered as a gender neutral X as a valid, a legally valid gender marker. And currently, 20 states plus DC offer an X gender marker on at least some state ID documents. And last fall, after more than 6 years of litigation, the Department of State finally granted intersex Colorado veteran Dana Zim the first passport from the United States that has an X gender marker. Well, the State Department also recently abolished the need to obtain a doctor's letter by allowing the self-selection of gender markers. They have stated that their systems and procedure to implement an X option on passports more broadly won't be available until later this spring. And I checked that today as just to make sure that nothing had come out. The guidance that they've provided is early 2022. So it really should be any day now. So super exciting news on that front. While this move to recognize genders beyond male or female does represent certain progress, pragmatically, there are still several challenges that having an X option raises. First, there are many systems that don't allow you to be anything other than M or F. So despite its fellow federal agency, the State Department, putting in the legwork to make an X gender marker happen, Social Security, which is currently the necessary first stop for pretty much all trans and non-binary folks seeking to change their gender marker, has name and gender marker has not announced intentions to either rescind their physician letter requirement or to allow the selection of X gender markers. Second, because cisnormative societal defaults assume that everyone is either male or female, having an X on your ID automatically outs you as trans and can thus become a material restriction on travel internationally and also through areas that may not be perceived as trans friendly, where it may not be safe for you if you get pulled over and you have an X on driver's license. These are just some of the criticisms that have led many trans and non-binary individuals to question whether an X is the correct way to legally recognize the diversity of gender identity, and also to question what the concept of legal gender, legal sex means entirely. If we're thinking about big long-term solutions to a lot of the issues that we discussed, especially during part one, I really do have to wonder, given the associated violence with not having a gender conforming ID, why do we print IDs, or why do we print gender markers on IDs at all? Like what compelling interest does it serve to weigh against the opportunity for harm that it creates? And one of the comments pointed out, very, very astutely, if you have a photo on your ID, doesn't that do more to help you identify a person than a sex box that has an MF or X? And then thinking about demographic tracking, I think there is absolutely use in making sure we can track different groups of people in our population, but there are ways to store that data in systems without printing that information on a card. And in fact, that's actually how Social Security does it. And that's how Medicaid does it already. Like you may not have even known that Social Security, you had a gender marker associated with your Social Security, but that's, as I mentioned earlier, that's your first stop. When you're legally transitioning, you have to update with Social Security before you can update with any state ID, because their systems are linked. So you can track that information without exposing people to potential risks of material harm. So last summer, in fact, the American Medical Association declared their support for removing gender markers from birth certificates. And they stated that, quote, removal of sex designation from the birth certificate would have little to no impact on vital statistics data collected for medical, public health, and statistical purposes. Currently, our best system is allowing trans and non-binary people to choose their gender marker without imposing any additional restrictions, requirements, or burdens. But maybe the best that we can aspire to is more of a fundamental rethinking of gender markers and legal sex entirely. Next slide, please.
Jordan, before you go, we have
Yes.
two comments. So there are three actually
Thank
comments. Miss Jai, your hand was up, and then we have two comments in the chat. So Miss Jai, you go, and then I can read the chat comments.
Thank you. Jordan, I just had a question. You'd mentioned the having the gender marker changed on one form of documentation, but that other systems like Medicare or Social Security are not following that. I would imagine that would make it more difficult than if something needs to change at one of those systems, because you'd have already a form of documentation that potentially couldn't be used in that system. Is that what you're seeing happen with folks who have X as a gender marker on that documentation?
Yeah, absolutely. And if folks have personal experience with this in this room, like I would invite you to jump in, because this is not something I've personally experienced, but it is something that I've definitely watched, clients and friends go through. And it's a challenge, so because a lot of times there's a competing interest of, I want my gender identity recognized, and the best way to do that is an X on my ID. But when I want to buy a Southwest airline ticket, there's no option besides male or female. So how do I get on that plane if I don't have an ID that matches? And so oftentimes, what I typically recommend for folks is if they want the X, to get it on whatever documents they're able to, which is generally, currently it's really only birth certificates and driver's licenses. Passports will be coming here really shortly. And then to keep one form of ID that has either an M or an F, so that if you do get into a situation where you have, I hate it. I hate telling people that you have to pick, but unfortunately that's what the systems do. And so to avoid potential mismatches or getting, no matches in systems, I do recommend often that folks will keep, at least currently, and then this, I think, this is an ever evolving discussion, but I do think it's wise for folks to keep an ID that has an M or an F, because so many systems do force people into that binary system, unfortunately. And that's a great question. It's one I get a lot.
So another comment is an argument I hear in favor of disclosing sex assigned at birth / gender is that biologically male and female bodies have different considerations when it comes to health or emergency medicine. Do you have thoughts on that?
Yeah, and so let me preface by saying here that like I'm not coming to this from the medical side. So again, folks with more expertise on the medical side, I welcome your comments and specific expertise on how to how to best medically obtain the information that's relevant, because I think that is right. Sometimes there are uses to knowing what someone's sex assigned at birth was. I think this is kind of an issue with intake forms generally. I don't think that there should just be one field of sex. I think you're missing a lot if you just have M or F and you're asking someone to circle. So I think that there are a lot better ways to ask those questions. I think asking people to self-describe their gender identity is helpful. And I think that the provider should have a level of fluency to understand that if someone writes, you know, trans male, what that means in terms of, you know, potential different biological considerations when it comes to, you know, prescriptions of medications or whatnot. I don't think it should be a question that stops and starts with sex MRF. I think that there are ways to capture that information about asking, you know, there are different ways to get at asking that information in a way that gives you what you medically need, and also well, frankly, protects you from getting information that's incomplete. Because if you give me a form that says M or F, I'm going to circle M because that's who I am. I'm not going to tell you I'm not a male. And if it is, but, you know, medically relevant, then like the opportunity there is missed to recognize that in me. And so I think that a lot of that comes down to how are you asking for that information in your intake forms, et cetera.
And we did discuss this in our January COP. Andrew Miller talked about how healthcare systems can create intake forms and forms that were affirming, and got to what Jordan was talking about. I'm going to jump over another comment and go to Dr. Riley Smith, who says, yes, medical records should ask for both sex and gender identity, but patients should self-report these. In an emergency situation where a patient can't communicate, no one is looking at their driver's license to find out the patient's sex and provide appropriate care based upon that. And that comes from Dr. Riley Smith, who's a doctor and trans guy here at Denver Public Health and Hospitals. Dr. Smith, did you want to unmute and say more about that, or does your comment sum up your thinking? Dr. Smith may be unable to unmute, so his mic doesn't work. But yes, that is my point. I don't have any other information. Okay, excellent. And then another comment is, I've also heard that getting that information can help increase funding for communities that don't get much / any. I would love to hear thoughts on that too. We discussed this in a COVID course we give.
Yeah, absolutely. That's Ty or someone kind of with more experience on the grant side of health. I can't speak very much to how that demographic data impacts grants, besides the fact that I know it does. So it's another good reason to make sure you're asking good questions.
And I think that does help with some communities with census data, but the census should ask for more complete information. And currently, I don't believe our census does a very good job at getting at that information.
Yeah, I think there's definitely validity to tracking gender identity. Absolutely. Like I think the more we know about people, the better. But forcing people to have kind of such a reductionistic letter that says absolutely really nothing about who they are imprinted on their ticket into society really just does nothing besides open up opportunities for discrimination and mistreatment, unfortunately. Okay, Are
Those are all
we,
the comments. Yeah,
sorry.
those were all the comments, Jordan.
Wonderful. Thank you so much. I appreciate that. I'm flipping between screens, so thank you for pausing to get those good comments in. Okay. Let me get back here. So I think we're back. Could we go back one slide here? I think we're on. Perfect. Okay. So you may be thinking at this point, like, this is all great information, but what does it have to do with me? And to kind of recap broadly what a lot of the discussion in part one was, fundamentally, a holistic view of HIV risk and prevention includes understanding its intersection with legal transition and transition access in general. Limited research suggests that legal name change may be an important structural intervention for transgender people, specifically for low-income transgender women of color, one that provides increased socioeconomic stability and addresses disparities in transgender health. Additionally, economic inequities are linked to HIV vulnerability. So when you improve economic outcomes, you decrease HIV vulnerability. As one study examining the interactions between legal transition and experiences of transgender women suggested, quote, loss of housing and employment due to transition, along with high costs of transition products and medical visits, increased reliance on sex work and created new obstacles in accessing HIV services. Transgender women experienced lower HIV risk as they acquired legal and medical transition services, reshaped interactions with sex partners, and received gender-affirming support by others, including health providers, employers, peers, and housing professionals. Affirming gender identity interpersonally and as a matter of identity records is critical in structuring HIV treatment and prevention programs at every stage. Next slide, please. So I see a few ways that you may be asked to intersect with somebody's legal transition. The first is as a medical provider or as a referral organization sending people to medical providers who may be asked to sign letters to support patients' legal transition. The second is as an institution that could potentially possess name or gender data of patients. In other words, as a record holder. And the third is as a general transition resource from whom patients might seek help or guidance for non-medical transition related questions. So if you aren't either of the first two, you may be acting as a bridge between transgender patients and organizations that do fill those roles. And if that's the case, I really want you to make sure that the organizations you're referring to recognize the full significance of their role in providing affirming care by proactively vetting the recommendations that you make. You can screen organizations by doing things like, starting with looking at their policies. Put yourself in the shoes of a transgender patient who you're referring and start asking questions. For example, do they require a letter to start hormone therapy, or do they provide care on an informed consent model? Do their intake forms ask preferred names and pronouns? Do they allow patients to self-identify their gender, or do they only ask for and use legal sex in their records? Are the providers and staff able to competently support a patient who may need to obtain a doctor's letter for their legal transition? Part of being able to vet organizations is also building relationships that will give you a network you can trust to give you honest feedback about the organizations you're referring to. So if it's appropriate, ask the people that you've referred out in the past about their experiences and create those feedback channels. Figure out if they would recommend organizations that you referred them to others. If they would, ask them why. Try to figure out what specifically made their experiences positive, and don't just take a recommendation at face value. For example, oftentimes transgender people have very limited options when it comes to service providers, even more so in very, very limited options for services. And in less trans-friendly parts of the country, you may find that organization is the only one offering a particular transition-related service within a 50-mile radius. So there may be, a lack of options, and maybe I'd refer someone because, well, what other option is there? Instead of, did I actually have a good experience? Did I feel like I was treated with dignity and respect? But most of you, I think, are probably going to fit into one of these three roles more directly, either as a provider, a record holder, or as a general transition resource. So let's go ahead and flip to the next slide, and we're going to talk about the role of providers. So if you provide health or mental health services directly to patients, you or those in your office might be asked to sign forms or letters to support a patient undergoing a legal transition. As we've established, this is obviously a huge deal to the patient, and it's important that your reaction conveys that you are both confident and competent in your ability to help them. If you're directly providing services, I would highly recommend, if you don't know already, that you find out what your state requires in terms of you playing a role in legal transitions. If you need to play a direct role, if your state requires, medical provider to sign off before someone can update their driver's license, then make sure you take your time and familiarize yourself with the forms and process that you maybe need to be involved with for the DMV, for vital records, for birth certificates in your state. However, as the law currently stands, regardless of what state you're in, you may be asked to sign a letter to support legal transition with the Social Security Administration, as it is a federal agency, or to support the legal transition of a patient who was born in a state that requires your involvement to change an out-of-state birth certificate. So even though, if you say you're a provider here in Colorado, we have great laws, people can do it without having to get your permission. But you maybe have somebody who was born in, off the top of my head, I think Oklahoma, for example, where they imposed, additional restrictions. But you as a Colorado healthcare provider, their current, medical provider might be in a position to sign that form for Oklahoma. And so, you don't need to know everything out there, because like I said, there are 50 different processes, but knowing what your state requires of you is the bare starting point. And I also want to notice a few other specific tips here. So first, some gender marker changes do specifically require a doctor's signature, so an MD or DO only. That is the case with Social Security right now. Other processes will accept other licensed professionals such as LPCs, LCSWs, et cetera. Ultimately, you are not responsible for making sure that your patient is doing the legal transition process correctly, but as a matter of professional responsibility, you should at least make sure that you know what you're signing. You should be familiar with the things you're going to be asked to sign regularly. And if you're asked to sign something unfamiliar, a really awesome starting place for information to find out, what the requirements are for another state is the National Center for Trans-Equality's ID Document Center. It's available at transequality.org/documents. They're a really wonderful, comprehensive resource that can get you started. And the second thing I want to note as well here is a term that you're likely to see in a document that you may be asked to sign, and that is appropriate clinical treatment. If you see this language, understand that it means that there is no specific medical treatment required for you to sign that patient's, to signal your support for your patient's transition. Appropriate clinical treatment simply means that the patient has or is undergoing whatever clinical treatment, if any at all, is necessary and appropriate for their individual transition needs or goals. And if that is zero medical intervention, then that's zero medical intervention. That is appropriate clinical treatment for that person's needs and goals. I strongly recommend that you be affirmative and proactive in offering yourself as a supportive legal transition resource to patients that are socially or medically transitioning, because legal transition often, but not always, is a process that they are looking to go through around the same time. And so, showing that you're aware, that this extends beyond just your role as a doctor, directly, and that you're there to support them, kind of the whole person. It sends really good signals to your patients. If you go to next slide, please. Let me see here. We've got a good amount to cover still, so I think I'm going to skip these Q&As and jump into the next slide, if we could, Zami, please. Thank you. Before we move into the next role and talk about CBOs as record holders, I want to read this patient quote from a study that I encountered doing research for this presentation to kind of help introduce this topic. Quote, "My provider was physically queer and that helped. Anytime his paperwork used unnecessarily gendered language, he would either mentally correct them or apologize and be like, 'You don't have to answer that.' There are a number of places that still insist on, if I have sex with a trans woman, that's a male having sex with a male. But my individual doctor is great, but the clinic at which he works is not. I've been told repeatedly that their system won't allow me to be listed as female. Next slide, please. So if your organization has record systems or databases that maintain any sort of identity data, such as names, gender markers, and or potentially even email addresses, because oftentimes people have a first name dot last name, at whatever.com, you may be asked to be a part of somebody's legal transition. That extends to a lot more people than you may have thought at first. As we're talking about the many administrative processes that are involved to change your gender marker, you have to realize that your organizations set your own administrative processes to guide patients in changing their names and gender markers in your systems. So this is the role that I see most, if not all, CBOs playing in some form, and it's the one that I think is really, really critical in making sure that your systems are designed thoughtfully and intentionally. So what's the goal? Transitioning patients are generally going to be in one of two places: those who socially, but at least not yet legally, have transitioned, and those who have legally changed their names and gender markers. Though you'll have to use slightly different approaches to meet both groups' needs, the goal should remain the same. Don't allow your procedures and systems to other trans people. So step one, in thinking about how you support all transitioning patients, you have to first be able to identify all of your systems that contain information that's going to need to be updated. And you need to think about everything from patient medical records to newsletters to billing and insurance information, prescriptions, etc. Be especially careful to thoroughly evaluate your automated and electronic systems. It's not just a sex field. It's often, what pronoun or what honorific your system will default to. Is it, Mr., Miss, etc. I legally transitioned 7 years ago myself, but after years of fighting with the VA, they have my name right in one system and my gender wrong in the other, and they have my gender wrong in another system and my name right in another. And then I just found out like 2 weeks ago that in some other system, somehow they have my gender and my name right, kind of, except that my first name is just straight up misspelled. So point being, it's important to make sure that there's consistency. It's not just one system. It needs to be a thorough evaluation of all of your electronic systems that are holding and engaging with any sort of individual patient data like this. So once you've identified the systems that will require updates, you can put them into two buckets: systems that are going to contain data that is required to match that person's legal name and or potentially gender marker, and systems that contain data where it doesn't matter at all. And making sure that you don't put too many things into the first bucket is the key to supporting patients who are undergoing social but not legal transition for whatever reason, whether that be costs, lack of access to legal resources, or just not being ready or not wanting to. When you have a clearer understanding of what systems you can update simply at the patient's request, then write up a procedure, test it, and then train your staff on how to complete it. Especially because of the disparate access that causes Black, Indigenous people of color, and low-income trans people to face both higher risks for HIV and a lower likelihood of being able to access legal transition, you must standardize asking for and using chosen names and pronouns and affirming gender identity when and wherever possible throughout your policies and procedures. Specifically, when we're talking about electronic health records, many, including Epic, are actually able to document both preferred and legal names. So if your organization relies on Epic or a similar program, then make sure you obtain, integrate, and utilize that updated feature. However, there are likely going to be some things that you just can't simply change at the patient's request absent a matching legal ID because it wouldn't be in their best interest. Something where there's potential for a mismatch with another system outside of your control that could result in them not getting something that they need. Your goal in this case for patients undergoing social but not legal transition is to provide maximum systemic support. So when there are opportunities to integrate preferred names, take them. Make sure that they interact with their birth name in your records and in your systems only when it's absolutely necessary. And beyond what's in your records, make sure that your intentionality on this subject is translating into practices that involve identity. So for example, avoid using honorifics in a waiting room, instead of just calling last names instead of Mr. Blisk, Miss Blisk, etc. One thing that you can easily control, make sure that you and your staff never use their legal name. Sometimes trans people refer to it as their dead name to address them when you're communicating with them. Let's see here. So let's go to the next slide here. We've got a little bit of time, so let's chat about. Let's pause here and chat real quick about, being what it means to be a record holder. So I'd love to hear from some of you. Hopefully this got you thinking about the systems that you have and how folks interact with them. Can you tell me, do you have a process? Is there, are you aware of all the systems that you have? Where are you in, making your systems as trans friendly as possible? Where are you in this? Do you need to evaluate your systems and see where is all of this data in the first place and how do we sort it? Are you at we recognize all the systems and we kind of know how to do it, but our staff isn't trained yet? I'd love to hear from some of y'all, what is that client experience going to be when they come to you and say, I want to update my name and gender marker? Feel free to also. Oh, thank you. Sorry.
We get a lot of pushback. So we're a clinic that's run through a university, but is housed at a larger medical facility. And so the systems that we're working in we don't have control over the systems themselves. And so we either get pushback around the ability to collect data or to reflect data in a non-legal way, or there's no clear way that actually takes place either. So recently I just had someone who changed their name who's cisgender, and in order for that to be updated in the system, there was no one really knew who had the ability to update it, or if we could just go in and edit it, or if that was going to mess up billing or all of these other pieces. So there's just no clear guidance, and there's a lot of folks who are just saying, oh, it's somebody else's responsibility.
Yeah, I think this stuff definitely has downstream effects and trickles down a lot. And that's why, for the folks here who are in positions to control and make decisions over these sorts of things, that's why it's so important to take that systemic, thoughtful approach in reviewing big picture. What does this look like? Because it'll be more efficient for you if you get it all in the first swoop, rather than trying to, oh, well, we did it in this one, now we need to replicate the process in this one. And that creates a better patient experience and better experience for staff and employees as well. Absolutely. Cool. Okay, so let's go ahead and move on to the last oops, can we skip here? I'm sorry, I think we got a little bit, I think I jumped these a bit out of order. Can we go to slide 19, Zami, for the resource slide? Awesome, thank you so much. Okay, so the last way that I see CBOs interacting with this topic is as a general transition related resource. And so in this role, the key is going to be knowing how to be an effective conduit of information, which requires you to know about national and local resources that exist. I know at least one of our CBOs has printed resources on legal transition that they offer patients. I'm including a quick list of state-specific resources here on the slide. And I tried to get one for every state in our region, and I think I got everyone except Wyoming, unfortunately. But it's by no means an exhaustive list of the organizations that might offer help with this. If you do see your state on this list and you don't recognize the name of the organization there, I would love for you to consider reaching out and connecting with these organizations. Building and maintaining good interdisciplinary relationships can be extremely helpful in supporting trans people who are transitioning. Transition is, as a trans person, I can say transition is not an experience that occurs in silos. And so we as professionals that support people with transition needs, we should not be stuck in silos either. Some other resources to investigate beyond the things included on this list include local LGBTQ plus resource centers and bar associations, civil legal aid offices, your state court website and self-help centers, as well as the National Center for Trans Equality's ID Document Center that I referenced earlier. This is also an opportunity for TA that I would be more than happy to help you with, researching, creating state-specific materials that can help you connect to your people with resources. Be more than happy to help, so feel free to reach out if that's something that you would like assistance in developing. If we could go back 2 slides, please, Ami, to the Q&A. I'm going to open it up now. We've got 3 minutes left here. Do we have any questions? Let's see here. Wyoming equality, good place to start resources for Wyoming trans folks. Yeah, absolutely. Yeah, there's folks are listing some really good resources. Zami mentioned for undocumented folks that you can reach out to Marisopa Sin Fronteras, as well as Queer Trans Pueblo. Yeah, again, the list I had is by no means exhaustive, but know that for a lot of you there is help out there. So with that, I'll open up the floor in the last couple of minutes here for any questions that we may have. Cool. Thank you. Okay. Well, hearing none, if anything comes up, I'm here. I work as an identity consultant. My job is literally to support you. So don't hesitate to reach out if anything comes up or there's anything that I can do to facilitate your amazing work. And then Zami, I will pass things back to you to wrap us out then today.
Thank you, thank you, thank you so much to Jordan and Callan. That was such a wonderful community of practice. In part two, I know I learned so much more than I did previously. Thank you all for being here today. Our next session is going to be on equitable access and representation in sexual health and PrEP services. It is scheduled for Tuesday, March 22nd from 11 a.m. to 12 p.m. Mountain Standard Time. Remember to change your clocks for our next one. If you have not signed up, please do. This will be a two-part series as well, with part one covering ways to create gender-affirming, comprehensive sexual health programming and the impact on status-neutral care and ending the HIV epidemic when we do not have these programs. And part two will go into detail on prescribing PrEP to transgender individuals. This will be a great series to invite your PrEP prescribers and clinicians to. Both of our presenters, Nevaeh Anderson and Dr. Riley Smith, were here today, and they will be covering it March 22nd for part one and part two on April 26th. Also, everyone will be receiving an email by 6 p.m. Mountain Standard Time with a link to a survey. Please complete the survey. We love your feedback. And for TA requests, remember to contact me, Zami, at zami.hemingway@dhha.org or do a request through CTS. Thank you again, and I'll see y'all on the 22nd.